Good afternoon or good morning, depending on where you are, everybody. We appreciate your taking some time to speak with us today. We hope that our session will be of benefit to you and your business. We hope that you're all staying safe and successful through these unprecedented times. My name is Tony Peterson. I am the Director of Sales and Customer Success here at NextTrust, and I will be your host for today's presentation. Today, we're going to be speaking about how you can improve your revenue by educating patients on their payment options using BillFlash. We will even be providing some additional education materials that you can utilize to share with your patients. So hopefully this is a very beneficial presentation for you today. Let me make sure that everything is set up and going the right way and that it's advancing. All right, so let's jump right in and talk about what we can do to help you collect more money from your patients by educating them about the process that they can expect to follow. One of the most important things that you can do when dealing with patients is making sure that they let's see, there's a little clicking there. Mari, if you could mute again, or any of the other presenters, please mute. That would be wonderful. It's important as we're dealing with our patients that we understand the processes that they're going through and that they understand the processes that we're going to be using to bill them. So if you want to make sure that patients are paying the most amount of revenue possible off of the bills that they have, the most that they're supposed to be paying, you need to do the following 5 things when utilizing BillFlash to collect from your patients. The first thing that you need to do is make sure that as you're talking with your patients, you're setting clear expectations about payments. The healthcare industry has, in some ways, not done a very good job of that. If you take one subset of the industry, however, dentists, for example, they do a fairly good job of making sure that their patients understand what the expectation is around payment. A lot of them do a great job in collecting that money before the visit even occurs. One of the reasons that dentists do so well with that is because they have had a higher portion of patient responsibility for a much longer period of time than we have seen on the medical side of things. So if you want to make sure that your patients are going to be more likely to pay, you can't say that you're going to guarantee that they pay, but making them more likely to pay can be achieved if you make sure they understand the expectations about the payments that you have. Whether you expect them to pay prior to the visit, how they can expect to interact with you, letting them know your expectations about how and when they should be paying you. The second thing is making sure your patients understand your payments process. There are many practices out there that have a multitude of different options for collecting payments from their patients. A large number of these practices, for some reason, are still taking a large number of check payments that are in office. That makes it a lot less likely that the patient's going to pay, and it delays the revenue to your bank account. So making sure that the patients have a clear understanding of not only when and how much you expect them to pay, but making sure that they understand the process by which they can very easily pay you. This is even more important as we've entered into the world of COVID quarantines and patients are at home, not out and about. We're needing to make sure that they understand their online payment options, which is number 3. You need to ensure that your patients not only know about your online payment options, but they know how to utilize them. There's ways that you can integrate your online payment options into your in-person visits as well in order to increase the distance that there is between your staff and the patient, to try to decrease some of the spread of the COVID-19 that we're seeing out there by reducing the number of interactions that are there. You also want to reach out to patients that you haven't seen lately, some ones that either owe you money or ones that should be seen for some of the care that is there. And then last but not least, you need to empower your patients and make sure that they have the ability to make the payments and that they have the tool set ready, that they understand it, and that they're willing to do that. So those are the things that we're going to be talking about on today's webinar. So before we jump in, I'd like to open up a poll on our GoToMeeting and ask a question about those of you who are on the call today. How do you educate your patients on their payment options? So the different responses that we have speak with your patient, printed materials, flyers, signs, electronically via website, emails, texts, on the patient statements, or we don't communicate payment options to patients. We've had about 30 to 40% of you who are voting. The majority of you are voting for speaking with the patient, and then there's a little bit that handle it through patient statements. There's slightly more who are using electronic means such as a website, emails, and text. Very few are utilizing printed materials like flyers and signs and in-office materials to educate their patients. There's a number of different options that are there. We want you to not only let us know what is available or what you're utilizing, but we want you to see what other people are doing as well. Only 17% of you are utilizing the printed materials, whether they be flyers or signs. I would include PDFs in that in some circumstances. So Mari, if we could go ahead and close the poll. We got about 2/3 of everybody who had voted. There were even 3% of those of you who were on the call who said you just don't communicate payment options to the patients, which is a fairly interesting approach. If the patients don't know how to pay or don't know what the options are that are available to them, they're going to be far less likely to pay. Some of the things that you will recognize in these situations will be scenarios where you feel like your reimbursements are declining. I've been in the healthcare industry for 21 years, and during almost every year that I have been there, there's been a trend of providers stating that they're frustrated due to declining reimbursements. A lot of that has to do with the fact that the patients are responsible for a larger portion of the bill. So making sure that we are communicating with them in just about every way possible is critical to making sure that we don't see declining reimbursements. Let's move on from our poll question. I appreciate your participation in that. If we want our patients to pay, we have to understand how our patients are thinking about their bills. When they receive a notification, they're going to go through 3 levels of understanding. This is research that came from Herbert Krugman from General Electric. He was doing public opinion research at GE, and what he saw was that when customers are communicated their financial obligations, these are the levels that they go through. At first, they're curious about the invoice and the bill that they've received. They don't necessarily agree with it right off the bat when it shows up. There may be some patients who do, but there's others who don't. That curiosity is basically a desire to understand exactly what it is that they're being billed for. In healthcare, that is one of the most difficult tasks to achieve because billing for healthcare is not a straightforward and simple task that most patients have a deep understanding about. So it's important that we're communicating with them and letting them understand all of the different things that they might need to understand that will allow them to move from curiosity to recognition. Recognition means that the patient understands this is what I am being billed for and this is how much I owe. When they recognize that they actually have a valid amount that they owe, then that leads them to their decision that they make, which is to either pay it or not. There may be a number of different reasons that someone pays it or not. Those could range from a simple desire to pay it to an ability to pay it. In our current environment, there's a fairly significant portion of the population that is unemployed right now. And so there may be some very real systemic issues with certain patients who are paying their bills or not paying their bills. But as a practice, please understand if there's 30% unemployment, that means there's 70% employment. It's still important for your practice in your office to continue billing your patients and finding compassionate ways to allow them to pay for the care that you're providing. So if you understand what the 3 levels of understanding are between your patients and their bill, that will allow you to more effectively navigate the process of taking them through that those different levels of understanding, and hopefully getting them to a decision of, yes, I'm going to pay this bill. Move on to the next slide here. Our first step in dealing with your patients and engaging your patients financially is to set clear expectations. You need to remind your patients that you are a business and that you require regular on-time payments in order to keep your doors open. If they value the care that your office provides, they need to pay for the care that they are responsible for. Otherwise, your practice will be unable to continue offering those services to your patients because you have financial obligations, as do your employees. If those obligations are not met, it will make it impossible for you to provide the care that you would like to provide. The thing, if you look at the MasterCard survey over contactless consumer reporting, 51% of Americans are looking for payment options for their bills that utilize contactless payment options like BillFlash and our online payment tools. It's important that you're offering all of the different contactless options for those patients in order to collect as much of that money as possible. Every time we talk about online payments, the providers that we speak with pull out the example that 85-year-old Medicare patients don't like online or electronic means of paying. And you're absolutely right. But that number is decreasing. If more than half of Americans prefer contactless payment options, if you do not offer those options, you are alienating 1/2 of the customer base that is out there, making it less likely that they're going to pay for you. As you go through the process of setting expectations with your customers, you need to make sure that you have pre-authorization for the visits that you're doing when there's insurance that is involved. If the patients are on a plan that requires the prior authorization and you do not achieve it, you're not going to be able to collect as much of that revenue as possible. There are a number of practices that have instituted pre-visit payments. When we say pre-visit payments, that could be anything from the copay prior to the visit occurring to any outstanding balances that are there. It's important that you recognize that a lot of patients will pay for their previous visit the next time they come in for another visit, for a subsequent visit. So as you are seeing those patients via telemedicine or in practice, you need to give them the option to collect those payments or to pay for those visits prior to seeing them, and that will increase the likelihood that they're actually going to pay you because they need something from you. They need to have the visit. So making sure that you do that will ensure that you're getting as much of that revenue as possible. You need to provide the contactless payment options like we've talked about. And another thing that you want to put into place is a COVID-19 office protocol. Your practice needs to determine which patients are going to be seen via telehealth, which ones are going to be seen in office. You need to utilize methodologies that will allow you to recreate the waiting room experience in both of those scenarios and that keep your patients safe and socially distant from each other while we're supposed to remain so. If a telehealth visit is occurring, then you need to offer that patient the ability to pay their copay and any outstanding balances prior to the telehealth visit occurring. Failure to do so is going to reduce the amount of money that you collect from those patients. In-office protocol is similarly important. If your practice has a gatekeeper, for example, sitting outside the front door who's taking temperatures of patients who come in, to ensure that your staff and other patients remain safe from the pandemic, you may want to institute a methodology where that gatekeeper is also asking the patients to make their co-payments and outstanding payments online using their phones prior to entering the office doors. That will minimize the amount of time that the patient is standing there at the front desk interacting within 6 feet of one of your staff. That could increase the likelihood that there's going to be a contagion that is spread through your office. And if you follow any of the sports who have opened up recently, for example, the Miami Marlins, you understand that once one person gets infected, it can very easily spread throughout your entire business and handicap what you're trying to do. So removing some of those interactions and using the contactless payment options in order to collect payments from in-office visits prior to those visits occurring will help you keep your doors open and maximize the amount of revenue that you're going to get, not only off of each visit, but it will help you maximize the number of visits that are able to occur. Let's open up another poll question, our final poll question for our presentation today, and that is, do your patients see you as a business? In healthcare, that is a very difficult question to answer, I think, for a lot of people. We've got about a quarter of you who have voted, and it is less than 3/4 of you are saying that your patients view you as a business. 32% of those on the phone right now, with about half voting, are saying that your patients don't see you as a business. If they don't see you as a business, then they're not going to be likely to pay their outstanding obligations. So it's important that your patients not only understand that you're there to help them with their care, but the business side of things, the paying for that care is what allows that to continue to happen. Communicating with your patients is the only way that that will occur. If we could go ahead and close the poll on that, Mari, that would be great. The final results were less than 2/3, about 63% of you who voted said that your patients see you as a business. A full 37% of you said your patients do not see you as a business. It is very critical that you help to transition some of that perception away from being a charity in some circumstances, unless you are a charitable organization, and be viewed as a business. All right, let's see if I can move on. How do we educate patients about your payment process? Well, there's a number of different options that you can utilize if you sign up for Bill Flash Pay services. That would include digital wallets where they can store their credit cards online and utilize them very easily. E-statements or e-bills where they're provided a HIPAA-compliant notification of their outstanding obligation and an ability to view the obligation through a secure online portal that will also allow them to pay that immediately through their online payments. Payment plans are a hugely important factor in getting patients to pay. As these patients receive the care that they need, many of them are going to incur large balances that may seem daunting for them to try to pay all at once. If a patient owes $500 and they think that the only way that that debt is going to be received is through a one-time payment of $500, they're just as likely to pay $0 as they are to pay $500. If you break that up for those patients into 5 easy payments, for example, of $100 that are automatically charged on a monthly basis, then you're more likely not only to receive money up front because they have a $100 barrier to entry, but you're more likely to actually receive all of the payment, all of that $500 that is owed. The stored payment options will also allow your staff to more effectively collect from those patients because the patients can more easily process their payments online. But in this world where your billers might be working from home, or if you are a billing service who is storing payment options for patients on file, when you receive those phone calls in from patients who are asking about their bills and they want you get them to the point where they're willing and able to pay, you can process those for them very easily through the Bill Flash Payments portal through their stored payment methods. So those different options that are there, if your patients don't understand that these options are available, then they're not going to ask for any of them. If you don't talk to them about the ability to receive e-payments or online payments or the ability to split up their payment into 5 easy automatic payment plans, payments through a plan, or their ability to store those online, they're not going to go do these things on their own. You have to remind them that they're paying for their care and make them aware that these are the expectations that you have as a condition of providing that care. 68% of patients prefer the contactless payment option, as we discussed previously. 92% of patients actually prefer advance notice of their responsibility, letting them know about what they're going to owe prior to the care being given. Now, we all know that the cost of care is greatly dependent on what happens during the visit, and you don't always know that going in. But educating your patients about approximately how much they owe and what those options are going to be increases the likelihood that they're going to feel that that need was satisfied and that they're going to be willing and able to make that payment for you. So how can you educate your patients? Over the years, we've had a number of discussions with numerous patients and numerous practices talking about how we can make it easier for them to know how they can go about making a payment. As such, we have created 3 different handouts for you that are available on today's GoToMeeting webinar. We'll also be sharing these with all of our customers, with you that are on the call. We'll send these out after the webinar is complete, and you'll have access to all of them. What these are PDFs that are in card form, or they're printouts that you can either print to a printer, save them as a PDF and email to a customer or a patient to let them know just how easy it is for them to make their payments using the options that we've talked about before. The first handout that we've got on the left-hand side talks your patients through how to pay their bill online without setting up an account using LinkPay, which comes as a feature with all Bill Flash Pay Services customers. There's 4 simple steps for those patients to go online and pay their bill using GuestPay, using LinkPay. Actually, the far left is GuestPay, the far right is LinkPay. So I had those mixed up. But GuestPay on the far left here will let your patients know if they go to myproviderlink.com, press the green GuestPay button, they're going to be given an account number and a form ID on their Bill Flash statement. If that's a paper statement, it's up on the top right-hand corner. It's on the same place on an electronic statement, but there's not a corner of the page. It's just at the top, the top of the screen that you have there. And all they need to do is click the GuestPay button, enter the account number and form ID, which is up on the bill. The payment amount is going to be filled in automatically for them from their statement. They choose their method, fill in the information, and hit submit. But we give them the link, we show them step by step how easy it is, and we have this on a card that you can utilize in your practice. Now think about what this means for your gatekeepers. If you have patients who are showing up at your practice ready for a visit, if you had these cards printed out for them, the gatekeeper who's taking the temperature before someone goes into the waiting room, they could provide the card and say, please make sure that you pay your copay and outstanding balance before entering the waiting room. And you can complete the payment process of check-in from your car or from outside the office, trying to keep everybody safe. All you need to do is grab that handout, print it out, and be done. Now, for a number of patients, if they want to use the items like Plan Pay or Stored Pay, they actually have to set up an account. Well, there's 2 easy steps to setting up an account. We've created a separate card or file that you can utilize to share with them and communicate how to set up an account on MyProviderLink. So you just take the information that is on this card. You can either provide them the card, you can email it to them. If you want to take this copy and create your own handout, you can do that as well. But providing these to your patients is going to make it far more likely that they're going to pay, because you're communicating to them not only the expectation that they pay, but you're giving them step-by-step, very simple, maximum of 4-step instructions on how they can pay their outstanding charges to you. Last but not least, on the right-hand side is where we talk about LinkPay, where a patient can go in and make a payment for a visit that hasn't even occurred yet. So if there's not a statement that's ready to be charged, you would use LinkPay in order to do that, and that's the far right card that you'll notice there, the 3 easy steps. I'm not going to walk you through all 3 of those there. These are available for download on the GoToMeeting in the handouts section. You'll see 3 PDFs that are there. The one says Guest Pay Cards for Offices. One says LinkPay Pre-Visit Pay Patient Charges and Payments. And the other says MyProviderLink Set Up a New Account. All 3 of those are available for you to download and utilize as you see fit in communicating with your patients. And I see that there was a hand raised. If you do have any questions, I failed to note at the beginning of the presentation, we do have a number of people who are on the phone monitoring questions. If you have a question, submit them through the question and answer link on the GoToMeeting, and we will get to those at the end of the presentation. We'll have Mari read those questions out to me, and we'll be able to answer those for you. So all of these handouts are available. They're not the only tools that we have at BillFlash. We're working on videos. Hopefully we have a video completed here within the next couple of weeks that shows patients how to complete these processes so that you can share those with them or link them on your website, so it's far easier for them to understand exactly what they need to do in order to complete their financial obligation with your practice. So, how do you offer your online payment options? First, educate your patients about them, utilizing the tools like the handouts that we talked about on the previous slide. Guide your patients. Show them where to go to complete the payments. Have signage in your office that talks about where they can go to do that. Many of them, as they're sitting there, are thinking about their health care. There's no reason they couldn't go on their phone and pay any outstanding obligations while they're sitting there in the waiting room. And then last but not least, offer a variety of payment options to your patients. If they want to pay it online, then let them pay it online. If they want to pay it by check, let them pay it by check. Over the phone, we offer that as well. But you need to speak with them and let them know that those are options. If all you do is send them a paper statement in the mail with a return coupon on the top, they may view their only option of paying that as either writing down a credit card at the top, which many people don't want to do because they feel like it's not secure, or they're going to wait until the next time they come into your practice before they pay you again. Either one of those circumstances is going to result in either a reduced or slower payment to your practice, which makes it harder for you to meet your financial obligations. Reach out to patients that you haven't seen lately. Communicate with them via email, phone call, mail. Invite them back to your office. Schedule an appointment. Talk to them about telehealth. Talk to them about how you are keeping them safe in person. Talk to them about options that you have about paying their bill. If the invitation is going out to someone who might have a large outstanding balance, they may be scared to schedule another session with you because they don't know how they're going to meet that obligation. Talking to them about options such as PlanPay, let them know that there's a way that they can still continue to receive that care and get those patients back into your practice. Make sure that you understand their current situation. If somebody has been laid off due to the pandemic, make sure that you understand that and you build into your plan in getting them paid or getting them to pay for their visit. Build in the compassion that will allow you to collect from those patients as they're able to pay. And also express to them how important it is for them to keep up on non-COVID care. Many people are scared to go to the doctor or to the hospital right now because of COVID-19. That doesn't mean that all of the pre-existing conditions that these people were suffering from have gone away and they require less maintenance. It means that they're not getting the maintenance that they need, which is going to result in worse outcomes for those patients. Communicate to them how your office can help them keep up their care on non-COVID items while simultaneously keeping them safe through the measures that you can also communicate with them. You want to empower your patients as well as communicate with them. Help them adapt to the changing situation in the world. Help them understand that adaptation is not only necessary, but it's going to be good in helping them through this process. Explain their EOB to them. Help them understand why they owe their bill that was potentially applied to their deductible or that was denied due to lack of coverage. Make sure that they have a full understanding of why they owe what they owe. That goes under educating your patients as well. Not only should they understand why they owe what they owe, they need to understand what their options are, which brings us to the next point, which is offer up the options. If you don't communicate these things to your patients, they are not going to ask for them in most circumstances. You may get some assertive patients who say, I can't pay that, I'm not going to pay it, give me a payment plan. But for every patient who does that, you're going to have 20 patients who just ignore the bill. So offer those options up to them and be transparent about what your needs are as a business and what you're able to offer these patients as they come in and are cared for by your practice. So with that said, I'm going to show you how simple it is to utilize LinkPay. We do a lot of different webinars here at BillFlash, and LinkPay is one of the easiest things that most practices don't even know about and don't even know that they have the ability to use it. What LinkPay is the ability for your practice to collect either a credit card or an e-check from anybody for any reason without a statement being required. So if we take our example of the person who's waiting at the door, checking people in and taking their temperatures, they could provide a link to LinkPay where your patient could come in here and very easily pay for their visit. So if I come in and Tony Peterson, that's my name and my phone number here, the account number would be the chart number, so it's optional. If it's a new patient, they're not going to have a chart number. And I'm going to do a $25 copay for visit on 8/4. I can then select a card. I type in my name, my card type, it's a Visa. That card number, believe it or not, is not an accurate card number, so don't worry. I'm not sharing anything that's illegal to share. This is what I can use for demo purposes. You enter in an expiration date, the address. And all I need to do is fill out that, do my CAPTCHA, verify that I'm not a robot, hit submit. I get a confirmation screen where I hit submit, and the patient is provided a receipt immediately. This is possible from any web-enabled device. If it's an iPhone, it works. If it's an Android, it works. All that the practice needs is the URL and a way to get there. So whether that's a text, an email, a website, if you have myproviderlink.com / the name of your practice. Now this has to be set up by your account manager. So if there's 2 Happy Valley Medicals, then it might be Happy Valley Medical Clinic, for example. But if you go in here and sign up for LinkPay by contacting your BillFlash account manager, if you have BillFlash Pay Services, they'll be able to help you determine after myproviderlink.com / what is your end URL going to be. It could be Dr. Tony Peterson. It could be Dr. Mari Sarmiento. It could be anything that you want as long as it's not already taken by somebody else. So if you have a very common name, you might want to reach out sooner rather than later. Anybody that has this can make a payment to you. If you are looking at different options that are there, I know that Square and Venmo, for example, have options where they're holding on to 30% of the payments that are made using their options for the businesses that are utilizing them. We do not hold on to those 30%. Those go straight into your account immediately, ready for you to utilize. So it's very, very simple for anyone to make a payment to you on any device utilizing myproviderlink.com and the URL that is custom for your practice. If that's something that you would like to set up, like I said, all you need to do, if you're using BillFlash Pay Services, speak with your account manager. If you have not signed up for BillFlash Pay Services, then speak with one of our sales representatives and they'll be able to set you up with that. This is also very, very beneficial for billing services to get these things set up on a practice by practice basis for each of the individual practices that you set up, because it makes it easier for your patients or those patients to make those payments and for you as a billing service to have visibility into them. All of these different tools are here and available. If you'd like to see anything that we've talked about today in more detail, we can set up a detailed demo for you where we will take you through the entire process. So if we come back to our PowerPoint presentation and wrap this up, at BillFlash, when you sign up for BillFlash Pay Services, there's a number of different options that are available that you can communicate with your patients, let them know this is how you can make your payments online, whether it's payment plans, automatic payments, or pre-visit payments. BillFlash Pay Services will allow you to do so. Let's see if I can move on to the next one. If we go through and talk about the specific options that are there one by one, guest pay is basically where patients can quickly pay their balance without having to set up an account. Most practices don't want to manage usernames and passwords for their patients. Guest pay makes it so that you don't have to do that. MyProviderLink.com is where the patient goes if they want access to more features, such as checking their balance without calling in or setting up automatic payments. They can register for this through BillFlash's payment portal, which is MyProviderLink.com. LinkPay is what I just showed you. PlanPay will automatically split the bill up into larger or into smaller monthly payments that will occur without you having to do anything. You don't need to set a reminder for your staff to go through and process the payment. When you utilize PlanPay, each month's payment is automatically going to be charged. And then we want you to recognize that online payments are the future of healthcare. So make sure that your online payment options are front and center whenever you bill your patient. This could include putting a note in their statement asking them to pay online, handing out the instruction cards like we printed out for you or we are sharing on the webinar today, and posting signs throughout your office that will direct the patients to your payment portal and how to do that. We really at NextTrust have one platform for smarter billing. Utilizing BillFlash Pay Services integrated with the billing options allows you to mail the bills, send electronic notifications of the bills, automate the billing for those patients, submit the payments from them, and we also have an integrated collection option where we can process your payments or your statements, and if somebody doesn't pay, we will move them onto a collection service. And then ultimately the goal of all of these activities is to receive the payment. If you do all of those different things, you're going to increase the likelihood that each patient pays you, and you're going to find yourself talking far less about declining reimbursements and finding different ways where you can provide care for your patients. With that said, we have, this is one of a series of webinars that we're working on. The next one, we've brought in a billing expert named Deanna Holmes. She's going to be able to take you through specific strategies that you can take with individual patients and individual types of patients on how to get people to pay when they just seem like they're not wanting to pay. It's going to be an outstanding presentation. We're planning it for August 27th of 2020 at 11 a.m. Mountain Time or 1 p.m. Eastern. When the PowerPoint is sent out to everybody after the session is over, there will be a link here that says register now. All you need to do is click on that and you'll be able to register for that free webinar with Deanna, and she'll be able to share that with you. So with that said, I'd like to thank you and open up the questions that might have come through. So Mari, did we have any questions that people asked during the presentation?
We do. We do have a couple of questions at this time, but I did want to mention that I just went ahead and sent through the chat the registering link for our next webinar. So I went ahead and put that through. So if you want to open up your little chat window, you can see that link there. Again, any questions that you have, submit that through the questions tab on the dashboard for this webinar. There is a question that we have. Looking at the statements, exactly where will they find the form ID that is required to pay through LinkPay?
That's a great question. Let me bring up BillFlash and I'll show you exactly where that is. No, that's not it. All right. So if we come in here, this is where you can see the statements that are there. Apparently, I don't have any files that are uploaded. So let me just upload a file out of one of our practice management systems real quick so that I can show you exactly where you're going to see that. Wasn't planning on showing that side of Bill Flash today, but it doesn't.
And while you're doing that, there was a...
Go ahead, Mari.
That's okay, Tony. There was a question if this is available for reviewing. Yes, we will have this sent to everybody, and it will be available on our Bill Flash website. So once we do have this recording converted over, then we'll go ahead and post that and send it out to everybody.
So that's great, Mari. Thank you. If you'll notice, what I have up on the screen right now is a copy of a statement that would be sent to a patient. This could be an electronic or a paper statement. The account number is right here at the top middle portion of the statement, and the form ID, the other number that you need, is right here. So these are the two numbers. If somebody has these two numbers, they can set up an account on My Provider Link and be able to utilize things like Plan Pay, Auto Pay, Stored Pay, looking up their balances without having to call the practice. Those two are going to be the key for those patients in setting up that account.
And then another question that we had is, are the practices notified if a patient sets up a payment arrangement?
Absolutely. The practice is not only notified, but you can see you are the one that initiates the payment arrangements. So if I come over here to the payers, I'm going to bring up the right practice here. And you'll notice that I have here on Steve Leistuck a stored pay that says pending. What pending means is that the patient has not authorized it, and has not done so via email. Active means that the patient has said, yes, I agree to this, and what we're doing is we're tracking whether the patient has authorized it. So if I edit this, you can put in authorization notes and the maximum amount that you're going to do for auto pay, for example, and then you'll be able to see that. But if I click authorize here, the patients will either be able to authorize the plan pay or the auto pay via email, online, or a paper authorization where you can print that out and say that you've received it. And we're tracking that so that if there's ever a dispute from the patient, we'll not only see the date and time that it was authorized, but we will also see the IP address of who authorized it. So these are initiated by the practice. So if somebody says, yes, sign me up for Plan Pay, all you would need to do is come over here to Plan Pay, click Add on that patient. Their monthly payment amount is $100 for 5 payments. And say we wanted that to start in October because the patient got laid off and we want to give them a little bit of time. That's all that we would need to do. Fill in the method that they would like to pay, and then have the authorization occur via email. As soon as the patient approves it with a click of a link on the email that's sent to them, it'll be good to go and up and running. But all of these are initiated by the practice. The patient does not initiate them without the practice's authorization.
Perfect. And it looks like that's all the questions that we have for today.
Well, thank you very much, Mari. Thank you all for joining us. I hope that we see all of you on our next webinar with Deanna. It's going to be an outstanding one. If you have any questions about anything that you saw today, I'd encourage that you reach out to your value-added reseller, or you can contact us at the information that is up here on the screen, and we can make sure that we bring your reseller into that conversation. We appreciate all your engagement today, your time. We hope that you're staying safe and successful and that you're finding a way through the new normal that is out there today. Thank you for your time, and we look forward to talking to you in a couple of weeks.